My name is Dr. Marissa Quinn, and I have worked in the emergency department of St. Catherine's Medical Center in Tucson for 11 years. People imagine the desert at night as quiet, serene even, but the truth is that silence here carries a different weight. It presses against the walls of the hospital, as if the sand itself is listening, as if the entire landscape holds its breath when darkness falls. St. Catherine's sits on the edge of the city, caught between the glow of downtown and the barren expanse of highway, too far from one to feel alive, and too close to the other to feel safe. The ER itself is a relic. Old tiles scrubbed so hard the grout looks bruised, fluorescent bulbs that flicker just enough to make you doubt your own eyes. The smell never really changes. Bleach, sweat, and the faint metallic tang of blood. It's not the biggest trauma center in Arizona, not the flashiest, but it's where the city sends what it doesn't understand. And when you've worked here long enough, you start to notice that some nights the building seems to know what's coming. I was raised between two worlds. My mother was a nurse who drilled into me that medicine was discipline, logic, and repetition. My father never missed Sunday Mass, which meant I grew up fluent in two languages, the measured numbers of blood pressure and pulse, and the reverent murmur of miracles. In the ER, you lean on science because miracles rarely show up on time. But there are nights, like the one I am about to tell you about, when the two overlap in ways that defy reason, and it leaves you haunted. That night, I was 8 hours into a 12-hour shift. My veins buzzed with caffeine, my head heavy from the mechanical hum of the place, the buzz of monitors, the hiss of oxygen, the metallic slam of gurney rails, the flat, tired squawk of the intercom announcing codes in distant wings. The waiting room was overfull. A young man hunched over with what I suspected was appendicitis, an elderly woman coughing wetly into her mask, parents rocking feverish children. In Trauma A man with chest pain paced circles around the bed like a caged animal, while his blood work trickled back from the lab. In Trauma C, Elena, our charge nurse, sutured a teenage boy who'd carved his knee open on a skateboard rail. You learn to live inside this rhythm. Vitals like drum beats, alarms like cymbals, the whole place moving to a strange and terrible music. But some nights the song changes. Something shifts, and you feel it in your bones before you ever see it. It happened just after midnight. The paramedics burst through the double doors, pushing a gurney so fast the wheels shrieked against the tile. On it lay a young woman, barefoot, her skin dusted with desert grit and blood from slivers of glass embedded in her soles. Her hair was matted to her forehead with sweat, her lips pale, her chest heaving with shallow breaths. "This is Adrianne Vega, 24, the medic called out, voice sharp and practiced, eyes darting between her and the monitor they clipped onto her finger. Found wandering near Valencia, disoriented, barefoot, confused. Heart rate 138, pressure 86/52, O2, sat 94 on room air. Pupils wide, reactive, temp normal. She won't say what she took, if anything. Keeps insisting someone's following her. Keeps saying she can't sleep." They wheeled her into Trauma B, where the fluorescents buzzed louder than they should have, or maybe it was just the way my nerves hummed in response. Adrianne's eyes weren't on us. They tracked something above us, following the metal curtain rail, as if it were a horizon line no one else could see. I stepped into her line of vision, leaning close but steady, the way you learn to with patients trapped in the jaws of panic. "I'm Dr. Quinn," I said, voice calm, deliberate. "You're safe here. We're gonna help you breathe easier. Adrianne, can you tell me what you took?" Her lips parted, but the words didn't come to me. They floated upward, directed at the ceiling, as if she were answering someone I couldn't see. "I told her no," Adrianne whispered. Her voice was brittle, a scrape of air, but the intent behind it was deliberate. "I told her no." Elena was already at her side, threading a 20-gauge IV into Adrianne's arm with the smooth precision of muscle memory. The saline hissed as it began to run, the tubing trembling faintly with each surge of her pulse. The monitor blinked awake, sinus tachycardia, with short bursts flirting at the edge of SVT. I moved step by step, piecing together what I could. Stethoscope to her chest, Lungs clear, though her breaths rattled with effort. Heart racing but regular. Skin cool, clammy, sticky with fear. I checked her eyes. Pupils wide, but reactive. Rectal probe. Temp 97.9, not fever. Orders spilled from me almost automatically. CBC, CMP, thyroid panel, tox screen, venous blood gas with lactate, troponin, urine pregnancy. Protocol is a kind of salvation. It's the skeleton of order inside chaos. You lean on it when the ground tilts under your feet. But as Adrianne's body wrote its argument on the monitor, I felt those guardrails shift. 2 milligrams Ativan, I told Elena. My voice was steady, but there was a hesitation under it I couldn't hide. We need to calm her heart rate, stabilize her before she crashes. Adrianne's head snapped toward me with startling clarity. Her eyes, dark and bottomless, locked on mine, not drifting past, not through, but into me. I need to stay awake, she said, every word sharp and deliberate. If I fall asleep, she will answer for me. Her fingers twitched against the IV line, as though testing whether the vein still belonged to her. Elena froze with the syringe in her hand. We both knew the rules. A patient's capacity to consent hinges on 4 pillars. Can they communicate a choice, understand information, appreciate the situation and its consequences, and reason about treatment? Adrianne could speak. She could understand some of what we told her. But how do you judge appreciation, reasoning, when her words are this, when the line between paranoia and recognition is carved into her face with such terror? What do you do with a sentence like, "She will answer for me," when the EKG is screaming and the blood pressure is collapsing? I should have paged psychiatry, should have stalled, bought myself more time, should have let protocol protect me. But the truth is, I saw something in Adrianne's eyes that stopped me cold. It wasn't the vacant terror of hallucination. It was the sharp, unrelenting fear of someone who knows exactly what she's running from. And that was the moment I felt it. That subtle shift in the air, as if the room itself had leaned closer to listen. Elena's hand hovered over the syringe, the clear barrel trembling almost imperceptibly between her fingers. The fluorescent light above flickered once, a stutter that seemed louder than it should have been, and in that split second, Adrianne's eyes widened, locking onto mine as if I had spoken a command she could hear inside her bones. "I can't sleep," she said again, louder now, her voice raw and scraping. "If I sleep, she'll wear me." Her heart rate jumped to 142. The monitor shrieked, a shrill alarm that cut through the room like a blade. Elena glanced at me, waiting. She had drawn up the Ativan because I had asked for it, because protocol dictated it. But medicine isn't only science, it's judgment. And in that moment, the burden of judgment pressed down on me heavier than the desert silence outside. "Hold," I said quietly, and Elena's fingers froze. We had to act. A heart rate like that, sustained, was dangerous. Blood pressure that low could spiral into collapse. Yet every time I looked into Adrianne's face, the logic of medicine seemed to blur. It wasn't just fear there. It was conviction, like someone trying to warn me of a fire I couldn't see. I tried again, shifting closer, lowering my voice. "Adrianne, listen to me. Your body is under strain. The medication will calm your heart, slow your thoughts, help you breathe. You'll feel safe." Her lips trembled, and for a heartbeat, I thought she might agree. But then her voice cracked into a whisper that curdled the air. "She's already here. She's waiting for me to close my eyes." Her hands clawed at the railings of the gurney, tendons straining, knuckles white. Elena shot me a look that asked silently, "What now?" I ordered another bolus of saline, trying to coax her blood pressure up through fluids alone. I called for labs to be expedited. A tox screen might tell us if this was drug-induced delirium. A thyroid panel might reveal an endocrine storm masquerading as paranoia. I even paged CT, knowing we might need to rule out a bleed, a mass, something structural pressing on her brain. But while we waited, the monitors told their own story. Her pressure fell to 82/48. Her heart ricocheted up to 146. And then something happened that made the air in the room go still. Her oxygen saturation, which had hovered in the low 90s, began to dip. 92, 90, 89. The waveform flattened into a shallow plateau that didn't match her breathing at all. I could see her chest rising and falling, rapid and desperate, but the numbers betrayed her. "Mask," Elena muttered, already fitting the non-rebreather over Adrianne's face. But Adrianne tore it off with a sudden violence, eyes blazing. "She wants me quiet," she spat, her voice startlingly strong. "She wants me gone so she can answer you." The monitor screamed again as her SATs hit 88. I pressed my stethoscope to her chest once more, expecting wheezes, rails, the mechanical noise of failing lungs, but what I heard was clear air movement, too clear. Her oxygen level made no sense, with lungs that clean. It was as though the machine was lying to us, or worse, as if something unseen was siphoning her breath away despite her body's effort. I ordered an arterial blood gas, knowing the result would take minutes we didn't have. Elena's hand hovered near the syringe again. "Doctor," she said softly, the question unspoken but sharp in the air. I nodded. "Give it." Elena slid the Ativan into the IV line, the clear liquid threading into Adrianne's vein. For a moment, nothing changed. Adrianne's eyes remained wide, locked on mine, her lips pressed tight as though she could hold back sleep with sheer force of will. Then slowly, her breathing eased, her shoulders relaxed, the frantic, jerking movements of her hands softened. But the monitors did not follow. Her heart rate spiked higher, leaping to 153. Her blood pressure plummeted to 76/40. Her oxygen saturation plunged into the mid-80s. The Ativan had calmed her body, but the machines recorded something else, something entirely detached from the physiology I could see with my own eyes. Elena cursed under her breath, already hanging norepinephrine, already preparing for the code that seemed inevitable. But then Adrianne spoke again, voice calm now, so calm it chilled me more than her panic had. "She's here," she said. "She likes it better when you can hear her instead of me." The monitors wailed in unison, every alarm a chorus of failing numbers. I leaned over, gripping her hand, searching her eyes for any sign of seizure, hypoxia, the telltale haze of a brain starved of oxygen. But her gaze was sharp, lucid, anchored in some reality I couldn't reach. And then, for a heartbeat, the air in the room felt heavier, as though someone unseen had leaned against my chest. Elena looked up sharply, eyes darting around as if she too had felt it. The pressure crept higher, with norepinephrine, stabilizing just enough to keep us from coding her. The oxygen sat flickered back into the low 90s, but the waveform looked distorted, as if the machine itself had been interfered with. I told myself it was artifact, interference, poor probe placement. I told myself what doctors always tell themselves when confronted with the unexplainable. But even as I repeated the rational explanations in my head, I couldn't ignore the look on Adrianne's face. Relief. Not from the drug, not from the fluids, but from something else. She smiled faintly, eyes drifting toward the curtain rail again, whispering to no one we could see. I told her no. But she doesn't need me anymore. A shiver worked its way down my spine as the monitor steadied, heart rate easing back into the 130s, pressure climbing into the 90s. It was as if the storm had passed, but not because of anything I had done. And for the first time in years, I felt a flicker of doubt stronger than science could soothe, the unsettling conviction that something else had answered in that room. The norepinephrine hissed into Adrianne's vein, its clear line trembling faintly in the fluorescent light. On the monitor, her pressure climbed from the abyss, 80/50, then 90/56, numbers that gave us just enough ground to breathe. Her oxygen saturation crept back toward 92, though the waveform still shivered and warped like static interference. It should have reassured me. It didn't. Because Adrianne was calm now, too calm. Her lips curled into a faint smile, a smile that didn't belong to a young woman pulled half dead from a desert roadside. Her eyes no longer darted around the room in terror. They fixed on the ceiling rail with a quiet serenity that chilled me more than her panic ever had. "She doesn't need me anymore," she whispered, almost gently. She's awake now. Elena froze beside me, syringe still in her hand. For the first time all night, she broke protocol herself. Who? She asked softly, her voice barely audible over the machines. Who's awake? Adrianne blinked slowly, as though Elena's question had to travel through some other channel before it reached her. Then she laughed. Not loud, not manic, but the kind of laugh you hear in a church when someone prays too close to the candles, thin, smoke-stained, reverent in its wrongness. She'll answer you, Adrianne said, not me. I told myself we had to keep moving forward. The labs were due any minute. We needed to scan her head, rule out a bleed or a mass, find something to explain the fracture lines running through her words. I ordered Elena to prep for transport to court. She moved briskly, glad for something mechanical to cling to, though her eyes flicked nervously toward the ceiling more often than the monitors. We wheeled Adrianne down the long corridor, its linoleum gleaming under two bright lights. The hospital was quieter now. The overnight lull had settled in, punctuated only by the occasional cough from the waiting room or the crackle of a code overhead. But as we rolled her bed along, the wheels echoing down the hall, I swear I felt the air thicken, pressing against my chest like a hand that wanted me to slow down. CT was empty, the tech yawning as we transferred Adrianne onto the cold slab of the scanner bed. He adjusted the cradle for her head, snapping it into place, his tone brisk and practiced. Hold still, sweetheart. It'll only take a minute. Adrianne's smile never faltered. She turned her head as much as the cradle allowed and stared straight at me. She's in here now, she said. Before I could ask what she meant, the table began to slide into the circular mouth of the machine. The motor whined, a hollow sound that usually fades into background noise, but tonight it felt amplified, reverberating down the corridor of my spine. I stood by the glass window, watching the scan unfold, my eyes darting between the images on the screen and Adrianne's still body. The tech frowned. Strange, he muttered, clicking through slices of the brain. No bleed, no mass, ventricles normal, gray-white differentiation intact. He shook his head. For someone this altered, this looks clean. Clean. That word echoed inside me with a sharp edge. Clean meant no answers. Clean meant her terror, her words, her collapsing body had no anchor in flesh or bone. We slid her back out, wheeled her toward the ER again. The hallway felt longer on the return trip, each fluorescent light buzzing louder than the last. I told myself it was exhaustion, my brain weaving hallucinations out of caffeine and fear. But halfway down the corridor, every monitor along the wall blinked in unison. Not hers. Hers stayed steady, every other monitor, lining empty rooms, each displaying phantom vitals for beds with no patients. Elena swore under her breath. The tech paled. I tried to rationalize. A power surge, a network glitch. But even as I told myself that, the hair on the back of my neck stood up, stiff with static. Back in Trauma B, the labs were waiting. I scanned them line by line, hoping for anything. An elevated TSH, an abnormal tox, an electrolyte imbalance, even a hidden infection. But they were maddeningly normal. CBC clean. CMP unremarkable. Thyroid panel within range. Tox screen negative for every common substance. VBG unremarkable. Lactate only mildly elevated from stress. Troponin negative. There was nothing but her words. Elena broke the silence first. What if this isn't medical? She whispered, her voice low so the other staff couldn't hear. She had been with me for nearly as many years as I'd been at St. Catherine's, and I had never heard her say anything like that. I wanted to snap at her, remind her that we were scientists, not priests, that medicine didn't leave room for shadows. But the words stuck in my throat. Because I had felt it too. The pressure in the room, the wrongness in the air, the way Adrianne's calm had seemed borrowed. I turned back to the bed. Adrianne's eyes were open, but not in the way of the conscious. They were glassy, focused far past the ceiling, as though she were listening to something above us that we couldn't hear. "Adrianne," I said carefully, stepping closer. "Can you hear me?" Her lips parted, but the voice that came out was not hers. It was lower, steadier, and carried a rhythm that sent a cold ripple through every vein in my body. "She told you no," the voice said, "but I don't need her anymore." The monitors wailed in unison, her heart spiking to 160, her pressure plunging again, but her body didn't move. She lay still, serene, while the alarms shrieked around her. Elena's hand shook against the rail, knuckles white as she clutched the metal. I leaned closer, every instinct in me screaming to pull back. "Who are you?" I whispered before I could stop myself. Her head turned sharply, eyes locking onto mine, and for the first time that night, I felt something looking back at me. Not confusion, not delirium, something else. Something deliberate. "You'll know when she sleeps," the voice said. And then the lights above us flickered, every bulb in Trauma B stuttering in the same instant. The room fell into shadow for the span of a heartbeat, and in that darkness I swore I saw a shape, tall, angular, pressed against the curtain rail, where Adrianne's gaze had lingered all night. When the light snapped back, the space was empty. But the monitor was not. It flatlined for a fraction of a second, before jolting back into rhythm, as if it too had been interrupted. I stood there, frozen, stethoscope heavy around my neck, the weight of my training useless in the face of whatever had just pressed its way into my patient's body. And all I could think was this: I had broken protocol to save her, and something else had answered in her place. The first flatline was brief, a stutter in the machine, but it was enough to knock the air out of the room. Elena lunged toward the crash cart, her voice already sharp with commands. "Pads on, EPI ready, push fluids." Her movements were pure protocol, muscle memory running faster than thought. But Adrianne wasn't seizing. She wasn't gasping or convulsing or foaming at the mouth like a brain starved of oxygen. She lay there still, her lips curved into the faintest smile, as though the alarms were background music and the fight belonged to someone else. "Adrianne, stay with me," I barked, slamming my stethoscope against her chest. Heart sounds galloped beneath the thin fabric of her gown, fast, erratic, but there. The monitor told me she was gone, yet my ears told me she was not. "Elena, check the leads," I snapped. My voice cracked, harsher than I intended. This could be artifact. She rechecked the sticky pads across Adrianne's chest, fingers moving quick and certain. "They're secure, Marissa. This isn't the leads." The monitor shrieked again, asystole, a flat line that mocked me with its finality, but my fingertips, pressed against Adrianne's carotid, felt the faint thrum of life. I wanted to believe the machine was lying. I wanted to believe a simple malfunction had turned a living woman into a ghost on the screen, but the weight in the air told me otherwise. And then Adrianne's mouth opened, and the voice that spilled out was not hers. "She's asleep now." The words coiled around me, low and measured, carrying a resonance that made the skin on my arms prickle. Elena stumbled back a step, her knuckles white against the bed rail. "No," I muttered, shaking my head, clinging to the rails of reason like a drowning swimmer. "She's oxygenating, she's perfusing, she's still here." I ordered compressions anyway. A young tech, barely out of residency, began CPR, his palms thudding against her sternum in steady rhythm, but every push felt wrong. The monitor stayed flat, yet Adrianne's eyes remained open, staring at me with unnatural clarity. "Between compressions," she whispered, not with breath, not with effort, but with a strange ease that cut through the chaos. "You broke your oath." My throat closed. "What?" "You gave her sleep," the voice said, "and now she belongs to me." The tech froze mid-compression, eyes flicking up at me in panic. "Did she just—" "Keep going," I barked. My voice cracked again, brittle with fear I couldn't mask. Epinephrine pushed. Fluids ran wide open. Pads stuck to her chest, charging with a whine that rattled my teeth. I pressed the mask to her face, squeezing the bag with practiced force, watching her chest rise under my hands. But the monitor mocked every effort, flat line holding steady, as if our fight existed on one plane and hers on another. I leaned close to her face, desperation pushing me past logic. "Adrianne, fight this! Stay with me!" Her eyes rolled toward me. For a heartbeat, I saw something. Her, maybe, buried deep inside. A flicker of terror, a plea. And then it was gone, replaced by that serene smile. "She doesn't want to stay," the voice said, "and you don't want her to." I staggered back as though struck, my hands trembling. Elena caught my arm, her voice low and urgent. "Marissa, what are we doing? Are we saving her, or are we—" She stopped herself, swallowed hard. Her question hung in the air like a noose. I forced my gaze back to the monitor. The flat line ticked on, cold and unyielding, but the pulse under my fingers still throbbed, faint, but real. My mind fractured in two. One half reciting ACLS protocols like scripture, the other whispering that I was trespassing in territory medicine was never meant to touch. "Call it," the tech whispered, his voice trembling. He had sweat pooling at his temples, his eyes darting from the flatline to Adrianne's open, staring gaze. "I'm not calling it," I snapped. "She's not gone." "Doctor," Elena's voice cracked. She wasn't challenging me. She was begging me. And then the lights flickered again. Every bulb in Trauma B dimmed to a weak, jaundiced glow, the shadows pooling like ink in the corners of the room. The air grew heavy, thick, as if the walls themselves had leaned closer. I heard it then, not a voice, but a sound. A low hum, like static wrapped in breath, vibrating just above the curtain rail. My eyes darted upward, and for a split second I swore I saw it again. A shape pressed into the shadows, tall, angular, leaning down as though listening to our struggle with a hunger that wasn't human. The tech stumbled back, abandoning compressions. "What the hell is that?" he gasped. "Keep going!" I roared, though my own voice trembled. But the truth was I couldn't look away. Because Adrianne's eyes were locked on the shape too, her smile widening into something grotesque. "She's awake now," the voice said, spilling from her lips though her chest didn't move, "and she likes your hospital." The monitors screeched, every one of them. Not just Adrianne's, but every bed in trauma, every room in the ward, each one blaring alarms in chaotic unison. The sound was deafening, a storm of shrill cries that rattled my teeth and sent nurses spilling into the hall. In that storm of sound, I felt something shift inside me, a crack in my certainty, a doubt that spread like poison through my veins. What if Elena was right? What if this wasn't medical? What if every drug, every compression, every desperate act was only feeding something we didn't understand? "Marissa," Elena whispered, her hand gripping mine so tight it hurt. "You have to decide, right now." I looked back down at Adrianne. Her body lay still under the weight of our efforts, but her eyes gleamed with unnatural clarity. The flat line on the screen was steady, final, yet her faint pulse throbbed under my fingertips. A contradiction that should not exist. A fracture between science and something else. I thought of my father's Sunday sermons, of the quiet voice that promised there were forces we couldn't measure. I thought of my mother's discipline, her sharp insistence that every symptom has a cause, if you only look deep enough. I thought of the oath I had sworn, to preserve life, to do no harm. And I thought of the voice that now spoke through Adrianne, mocking me with truths I couldn't disprove. "You can't save her," it said softly, "but you can join her." My chest tightened, not from exhaustion but from something colder, sharper. A pressure pressing down from above, as if invisible hands had settled over my ribs. For a moment, I couldn't breathe. Elena yanked me back, shaking me hard enough to snap my gaze away from Adrianne. "Marissa, look at me. Don't listen." But it was too late, because I had heard it. Not just in my ears, but in my bones. And for the first time in my career, I didn't know whether the fight before me was one I was meant to win. The alarms screamed on. Adrianne's eyes gleamed. The shape above the rail leaned closer. And I realized that whatever answer I chose in that moment, protocol, prayer, surrender, would not belong to me alone. The storm of alarms did not relent. Every monitor in the ward screamed in unison, a cacophony that turned the sterile ER into something feral, something alive. Nurses crowded the hallway, their faces pale in the flickering light, but none of them crossed the threshold into Trauma B. It was as if the room itself had drawn a line, daring anyone to step inside. Elena stood beside me, her hand clamped so hard around mine that my knuckles ached. The young tech hovered near the crash cart, his eyes wide, his body trembling with a fear that went beyond inexperience. He had seen codes before, but not this. Not a patient lying still with eyes wide open while machines flatlined and a pulse throbbed faintly under my fingers. I pressed harder against Adrianne's carotid, clinging to that thread of life. It was there, weak, erratic, but real. Every beat a contradiction. The monitor lied. Or the body lied. One of them. Maybe both. EPI again. I ordered, my voice hoarse. Elena hesitated, then pushed the syringe into the line. Clear liquid flowed into Adrianne's vein, chasing the norepinephrine that already surged through her. We waited for the rise, for the surge of pressure, for the monitor to catch and reset. But nothing changed. Her blood pressure remained unreadable. The flat line held steady. Only my fingertips, pressed against her neck, felt the truth. And then her lips parted. "She's almost done with me," the voice said, calm and even, resonant in a way that made my chest vibrate. "But she likes this place. She'll stay." The young tech muttered a curse and stumbled back, knocking into the cart so hard the defibrillator pads clattered to the floor. Elena's grip on me tightened, her breath ragged. I wanted to scream at them, at myself, at the machines that told me lies. But my voice caught in my throat because the truth was there, unspoken. I felt it too. The heaviness. The weight pressing in on us. A presence not measured by vitals. Not recorded in labs. Not ruled out by a clean court. The lights dimmed again. The shadows thickened, pooling above the curtain rail where Adrianne's gaze had lingered all night. For a heartbeat, the hum in the air deepened, vibrating in my ribs, making my teeth ache. And in that vibration, I almost heard words, not from her lips, but from the very walls around us. "She told you no, but you said yes." My hands shook. Protocol demanded I keep going. Science demanded I fight. But something deeper whispered that every drug, every compression, every desperate act was not saving her. It was opening the door wider. "Doctor," Elena whispered, her voice broken, "what do we do?" I couldn't answer. I didn't know if there was an answer. Adrianne's eyes rolled toward me once more, sharp and lucid, though her body remained still as stone. For a heartbeat I saw her, just her, buried under layers of fear. And then it was gone, replaced by that faint, terrible smile. "You should stop," the voice said through her. "She doesn't want this anymore, but I do." The alarms blared, the monitors screamed, and my world fractured into two truths. One, she was alive under my fingers, fragile but alive. Two, she was already gone, her body borrowed by something that should not have been there. I thought of my father's sermons, the way he spoke of spirits that slip between worlds. I thought of my mother's steady voice, insisting that medicine is the only shield we have against the unknown. I thought of the oath I had taken, to do no harm, to preserve life where I could. And I realized, with a clarity that chilled me, that sometimes those promises collide. Because what if preserving life meant holding open a door that should have stayed closed? The room trembled with sound, monitors, alarms, the low hum that pressed into my bones. I closed my eyes, just for a moment, and whispered a prayer I hadn't spoken in years. When I opened them again, the light steadied, the monitors quieted, not all at once, but gradually, like a storm bleeding into silence. One by one, the alarms fell silent, until only Adrianne's monitor remained. Flatline. Her pulse under my fingers? Still there, weak, erratic, defiant. I pulled back, my hand shaking. Elena stared at me, her face wet with tears she hadn't noticed. The tech slumped against the wall, whispering something under his breath. Prayers, maybe, or curses. We didn't call the time. We didn't stop the drips. We didn't disconnect the pads. We just stood there, suspended between life and death, watching a young woman breathe shallow breaths that the machines refused to acknowledge. Hours later, though it might have been minutes, her eyes finally closed. Not with the violence of collapse, not with the peace of sleep, but with the inevitability of surrender. The monitor never moved. The flat line stretched on, endless. Elena whispered, "She's gone." But I couldn't agree. Because her skin was warm. Because her pulse, faint as smoke, still throbbed under my fingertips. Because when the air conditioner cycled on, I felt the weight in the room shift, as though something had finally stepped away. We transferred her to the ICU in silence. I wrote my note in the chart, the words clinical and hollow, unexplained cardiac instability, flat line on monitor, faint carotid pulse, condition guarded. I didn't mention the voice. I didn't mention the shadow. I didn't mention the way the machines lied while her body lived. Because medicine has no code for that. Days later, when I passed the ICU on rounds, her bed was empty. No discharge summary in the chart. No death note either. Just gone. No one could tell me where she went. Some said she'd been transferred to another hospital. Others said her family had signed her out. The ICU nurse swore she had been there one night and gone the next. The bed stripped bare, the monitors dark. No trace. And so I'm left with the silence. The silence of the desert pressing against the walls of St. Catherine's. The silence of a chart that offers no ending. The silence of my own heart when I ask myself what I truly saw that night. Was it medicine failing? Was it madness born of exhaustion and fear? Or was it something else? Something I can't measure, can't diagnose, can't save? I don't know. I only know this. When the lights flicker in Trauma B, when the monitors stutter for no reason, when the air feels too heavy to breathe, I remember Adrianne's eyes and the voice that spoke through them. The case will always remind me that medicine can mend flesh, but it cannot guard the soul. The case will always remind me that some patients don't belong entirely to us, no matter how hard we fight for them.